The major medical focus for almost a year now has been the coronavirus. But where do flu cases stand this season?
And is it possible to test positive for both COVID and the flu? Western Mass News reporter Lena Jakowski is getting answers.
Peak flu season is typically right now, but the case count at Baystate Health in the last month? 0. Coronavirus and influenza are very different viruses, and according to infectious diseases doctor Armando Paez, this really highlights the contagiousness of COVID-19 versus the flu.
With most of us doing appropriate social distancing and face masking and the vaccination for the flu really helped curb that flu activity.
Baystate has the ability to test for common respiratory virus or RSV, flu A, flu B, and COVID-19 simultaneously. Paez says this is the only way to differentiate between viruses during this time. If COVID positive, the sensitivity of the test will not tell you what particular strain you have, but it will pick up on newly developed variants.
We got reassurance from the laboratory, the manufacturer of the test kits that they're able to detect the variants.
Western Mass News also spoke with Luis Cardelina, a physician assistant at AFC Urgent Care, who says this year they've only had one patient test positive for the flu.
Now would normally be typically the time when we'd see it be really high. However, interestingly enough, in our office in Springfield, we've only seen one case so far of positive flu, and that person happened to have A and B.
Testing positive for both influenza A and B is rare. Cardelina also tells Western Mass News that the decrease in cases is likely due to COVID safety protocols and that an increase in people getting the flu vaccine has helped keep numbers low this season. However, out of an abundance of caution, it is still necessary to test for both.
It's important to know, is it the flu? Because we could treat it. And is it COVID? Because then they need to tell everyone they've been around. So there's different ways of handling it depending on what it is.
And while the viruses share many common symptoms, there is one telltale sign that it's not the flu.
Losing taste or smell. That if someone says that to me, there's a very high probability they have COVID.
Dr. Erica Hamilton, a microbiologist at UMass Amherst, adds that distance learning may be playing a role in the dramatically low flu case count as well.
School kids are the biggest transmitters of the influenza virus or the flu. They spread it to each other at school. They then bring it home and they infect their families at home.
According to the CDC, all 50 states are currently displaying minimal to low flu activity.
Well, it is statistically possible to test positive for both the flu and COVID. According to Cardelina, so far, no one has. For Western Mass News, I'm Lena Jakowski.